Hello, welcome to another video segment on the topic of limb lengthening. Today, I would like to discuss with you the different types of bone cutting. Before the implant is placed in the medullary cavity, the bone must first be cut. There are basically two different ways to perform the cutting of the bone. One is an internal cut, meaning it is performed from the medullary cavity itself. This is relatively elegant, as no additional incisions are needed and the surrounding tissue can be very well preserved. Or an external cut through additional small incisions. Let's first discuss the most commonly performed external cut. For this, you need an approximately 30 cm long drill with which the bone is weakened in a fan shape and finally broken through with a chisel and a hammer. This method of bone cutting is the most common, as no special tools are needed, just a drill, a hammer, and a chisel. No special techniques are required for the cutting either. The major problem or the major risk associated with this procedure is as follows. Here, I will show you a cross-section of the thigh at the cutting height. You can clearly see the femur and its medullary cavity. This is located centrally in the thigh area. Additionally, the adjacent important structures, arteries, veins, and vessels are marked. The cutting is generally done through 92 auxiliary incisions placed opposite each other to hit and weaken as many areas of the bone as possible with the drill. Subsequently, the remaining bone bridges are broken through with a hammer and chisel. You can see that one must penetrate large distances of soft tissue just to reach the bone. Must. This is unavoidable, as the target structure is located centrally in the thigh. Thus, it is unavoidable that additional skin incisions are needed and tissue damage is caused on the way to the bone, as well as an increased risk of introducing germs from the skin to the bone. However, the far greater risk with this type of incision lies with the adjacent structures that are in close proximity to the bone. These must not be damaged or destroyed under any circumstances. Otherwise, there is a great danger to the limb. Drilling into the major leg artery can be just as fatal as drilling into the major nerves. This danger is especially present when drilling with the long drill bit beyond the level of the bone, and in doing so, accidentally injuring important structures. It becomes even more difficult in the lower leg area. Here you see the lower leg bones in cross-section with the surrounding structures. Here, nerves and vessels are even closer to the bone, and the external incision must be made much more cautiously. Otherwise, important structures can be quickly compromised. And damage to the nerves generally results in severe paralysis. An exception is the fibula. The fibula can only be cut from the outside, as the medullary cavity of the fibula is too small for an internal cut. In contrast, I prefer the internal cut through the identical incision needed to insert the nail so that no additional cuts or scars are created. However, you need special equipment for the internal cut. The most important thing is a custom-made special saw, which is prefabricated for different medullary cavity sizes and has an eccentrically positioned saw blade. Schematically, they have a guide piston that exactly fits the diameter of the medullary cavity and corresponding saws that can be unfolded. These saws then remove a little more of the bone wall, with each unfolding until it is completely severed. This spares the surrounding tissue and avoids serious complications that could otherwise arise from an external cut. Since the femur is often elliptical, small bone bridges usually remain, which can then be easily severed with the vibrating saw. I will show you this with an example video. You see the femur at its upper end. The gray area of the tube is the medullary cavity. The dark edges represent the bony wall. On the X-ray image, you only see a two-dimensional representation. In reality, however, the bone is round and hollow inside like a tube. The saw is placed in the medullary cavity, and through slow manual rotational movements, the bone is gradually thinned from the inside, in a circular manner, at the level of the saw blade. The saw is then unfolded and repeatedly changed to a larger blade until the maximum is finally reached. In the end, you only need to slowly cut through the remaining bone bridges with a vibrating saw. Subsequently, the bone is completely severed. The surrounding soft tissue is preserved, and additionally, there is the assurance that the adjacent structures are intact. The internal severing requires special tools and demands some skill from the surgeon, but it is a very elegant and safe method for the patient.